Welcome back to Great Day St. Louis. Take a look at your teeth. I know it's hard to do, but I would use a mirror. Are you missing a few? Are you missing more than a few? If you are, then you probably just see the gaps every time you look in the mirror, but it doesn't have to be that way. Dental implants can help you get your smile back looking better than ever. And we are always happy to have Dr. Richard Boatman with us of Troy Family Dental in Troy, Illinois. And it's great to see you, sir.
Great to be back.
Always great to talk about the good work you do up there. I've been in that office. It's like no dental office I've ever been in before. That's a big part of it. I mean, the facility itself. But the people that you've managed, I don't know how you do it, but everybody that works in that office is so friendly and so helpful.
They're amazing. You find some diamonds here and there, and you keep those diamonds, and they're highly trained, and they're the best dental staff on the planet.
It's a great experience, and I know that another thing, maybe we can talk about it a little bit, another thing that you're very concerned about is making sure that people are comfortable and not in pain.
Absolutely.
Both during the procedure and after.
Absolutely. Absolutely. So we have a lot of sedation techniques. We do a lot of IV sedation. Patients can actually be asleep, wake up, and their procedure's all over. Don't remember a thing.
All right, let's talk teeth.
Yeah.
Implants a big part of your practice. What are dental implants, just for those who aren't familiar with them?
So implants are actually an artificial tooth or root that we put in, and there's different kinds. We're actually one of the few practices that does both. There are traditional implants. There are mini dental implants that we sit down with the patient. We find out what their wants, their needs, their expectations are. There's so many different options that we can give them according to their budget and what they're looking for.
And here's what I think maybe some people get a little confused about is what exactly is the application? In other words, if I'm just missing a tooth, or do I have to missing all of my teeth or some of them? Do I have to have dentures? And the applications really run the gamut. Right?
They do, from A to Z, absolutely. There's so many people out there with what we call terminal dentitions, which means their teeth are in such bad shape, they don't have a choice. They're going to lose them.
Right.
And so there are a lot of different options. The best that dentistry has to offer is what's called an all-on-X, where we can remove their teeth.
Let's leave it on the table, because I want the camera to be able to zoom in on it.
We can remove their teeth during surgery, during IV sedation. Their teeth come out, the implants go in, their prosthesis is actually screwed onto the implants. It cannot come off. It's just like having your natural teeth. And so they go from a terminal dentition to something very permanent right there on the spot.
So this is for people that had their teeth pulled because they were just so bad.
Right.
All right. Now, dentures are a whole different ballgame.
Yeah. Dentures are tough, especially lower dentures. Lower dentures, we call them floaters. There's nothing down there to hold it onto. It just kind of floats. So we can actually place, in some cases, some traditional implants. We can maybe place some mini implants. And then what you can do is you can put those snaps up into their denture. And then when it goes into place, it snaps right into place. No more denture glue, and now they can bite a lot better.
Now, if that was the only benefit, that would be great and well worth it. But you also are able to trim a lot of, whether it's the lower or the upper, off. And like on the upper, you're talking about your palate, and maybe the gag reflex is an issue for some people, or maybe they can't taste their food as well, or their speech is impaired by that.
All three. A lot of people deal with that bad gag reflex. Some can't even wear a denture. So we can actually place traditional implants or even mini implants, and then that palate comes off.
Right.
No more gag reflex. It snaps into place just like a bottom one does. Now they eat much better. No gag reflex. They taste their food much better.
And keep in mind, we're not talking about reinventing the wheel. We're not talking about making a new set of dentures. You're taking the existing dentures.
Yep.
Trimming them down and semi-permanently mounting them.
Absolutely. So if that denture is in really good shape, the average denture lasts 10 or 12 years. So if their denture is still in good shape and it's thick enough to put snaps into it, a lot of times we can just use their existing denture.
Wow.
Transforms
All right,
their life.
and then not just for dentures, not just for a whole upper or lower, but if you're missing a few teeth.
If you're just missing 1 or 2 or 3 teeth, we actually use robotics to place those. So we're the
I witnessed that. It is crazy technology.
It's amazing. So we're the only general dental practice in all of Illinois that has it. So we can take that implant, put it on the CT scan, link the CT scan to the robot, link the robot to the patient. I have that robot in my hand, and when it gets in the perfect spot, it locks, and it puts that implant in the perfect spot every single time.
Man, And I've witnessed that, and it's nuts to watch.
It's amazing.
Dentistry's come a long way.
A long way. We didn't have
really
the computers when I first started.
I used to be scared to death of my dentist, but now, you know, you go into it, especially an office like yours, it's crazy. All right, Troy Family Dental. Our favorite dentists. They're located in Troy, Illinois, which is about 20 minutes from Many Bridge. You can give them a call at 618-477-8421, or you can visit TroyFamilyDental.com, and you can get more information. You didn't throw Dr. Spencer off one of those bridges, did you?
No, he's on vacation this week.
Oh, okay,
Yeah.
that's good. Well, tell him we said hi.
I will. Okay.